this is a video for the Newcastle and Gateshead community treatment teams for their DBT informed skills group, and my name's Deborah. So I'm just going to do a short video that talks about what's involved in the DBT informed skills group that we run in Newcastle and Gateshead. So to begin with, I wanted to tell you what DBT was. So DBT stands for Dialectical Behavioural Therapy, okay? And it's an approach that was developed in America by somebody called Marshall Linehan, okay? Marshall Linehan started working with people who were experiencing real high, either had made attempts to end their lives or experiencing really high feelings of wishing to end their lives. People who she described as highly suicidal people. And she was working with these people to develop the kind of best way forward, the best way to help them. In more recent years, Linehan's come out in, I think, 2011 and said that she had, when she was a young woman, when she was 17, she'd had a psychiatric hospital admission and experienced some difficulties similar to the clients that she spent most of her life and career working with. And I think that really comes through in the approach that Linehan developed for these people, because DBT. Because you can tell, for me, that it's not only an approach that's developed based on her as a therapist, but it's also based on her own experience of having had similar problems. Okay, so when she was working as a therapist, she started offering the clients, the people who were really either making attempts on their lives or experiencing thoughts to end their lives, she offered them CBT initially, which is cognitive behavioural therapy. And she discovered that some of it was helpful, but there were some issues. And one of the issues was that she was teaching the people who were coming to her sessions the same skills over and over again in every session. So what she decided to do is to offer them like a class to go to, like you would if you were going to college, or if you were doing any sort of learning, to go a place to go to learn those skills. And then on top of that, she offered them individual sessions and some phone contact. And that's the full programme DBT that's offered, okay? In more recent years, it's been acknowledged that there are lots of different elements of the DBT programme that can help people either with thoughts to end their lives or with thoughts to do harmful things to themselves or others, maybe drinking alcohol, maybe getting into destructive relationships, maybe doing impulsive things, maybe spending too much. And there's lots of different client groups that can be helped by these. Initially, the work that Linehan did in America was particularly targeted towards people who fit a diagnosis of emotionally unstable personality disorder. But more recently, it's been recognised that there's people with lots of different diagnoses, perhaps depression, perhaps eating disorder, some people who've experienced psychotic symptoms who can benefit from the skills that she's pulled together and the approach that she developed in America. Okay, so Linehan herself produced a new book. So this is her most recent book. I don't know if you can see it there. Okay, I haven't got the actual book copy. And in that book, she offered not year-long programmes, but some shorter programmes that were informed by the DBT approach. The shorter programmes is what we offer in the Newcastle and Gateshead community treatment teams, and they cover roughly 12 weeks. The skills that are included are skills around mindfulness skills, distress tolerance, which is essentially skills that help you manage in a crisis, emotional regulation skills, they're skills that help you to understand and manage your emotions well, and interpersonal effectiveness skills, which is a long way of saying managing your emotions well. Okay, so that's what the DBT informed skills group is.